Do you need this book for now?
Oh, why, hello there. Oh, what?
Do you need this book for now?
No, not right now.
Okay.
So guys, right now we're going to be talking about delegation. I know that Nclex is really big. There's going to be a huge push for your Nclex to have more delegation, more prioritization, and more leadership. So if you are in nursing school, specifically RN school, they're going to have more delegation type questions. So right now, I'm going to give you the skinny on how to focus on keywords and identifying these keywords for your delegation types questions. There are 5 keywords that you have to know when delegating patients and delegating tasks. So here are the 5 things that you cannot delegate. And I break it down into a little acronym called PACET. Now, I used to call it packet, but a lot of people were saying, packet spelled with a K. Okay, whatever. However you want to say it, packet, okay? So, as an RN, you cannot delegate what's called nursing process, okay? Your school might call it SOAPy. Your school might call it ADPI. My school called it DAR. But pretty much you can't delegate these 5 things. And I just break it down into called packet. You cannot delegate planning, okay? Planning in terms of collaboration or planning the goals for the patient. You can't delegate that to an LPN if you're an RN. You can't delegate that to a CNA because you are assumed full responsibility. Oh, nice catch.
Thanks.
Of the patient. You can delegate, but you assume full responsibility. There's no sharing in terms of responsibility. You assume, you delegate, but you are the, you maintain that responsibility. So planning for your patient's goals, that care plan is your responsibility. The next thing that you cannot delegate, let me write this down. So cannot delegate, okay? Someone's gonna rip me a new one because they're like, that's not how you spell delegate. I don't know. Anyways, is that how you spell delegate?
No.
Okay, well anyways, that you can't delegate. The next one is assessments, okay? Now, you can delegate secondary assessments. You cannot delegate primary assessments. So, a good patient for a good question for them to ask on the Nclex is, which patient out of these 4 patients would you delegate? Would you delegate the post-op patient that's freshly out of post-op? Would you delegate the new admit that's coming right in? Or would you delegate the 3-day-old chest pain patient? Which one?
3-day old.
3-day-old chest pain?
Mm-hmm.
With chest pain.
But it's 3-day old.
Okay,
He's been in
good.
the hospital for a while.
So he's stable, right?
Right.
So the most unstable one is a fresh post-op?
No, he needs immediate attention.
Good. So you have to have an initial assessment on that guy.
Right.
What about your new admit?
You still need more information to gather for him, so you won't delegate that.
Perfect. So your first assessment cannot be delegated.
Yes.
So that's what's called vigilant assessment. So your next thing is collaboration. Collaboration. Now what is collaboration?
Working together.
Cool. So if your patient needs a wound consult, if your patient needs a, let's say, social services,
A respiratory?
respiratory therapist, right?
Mm-hmm.
It's the RN only that does this collaboration. Dietary services,
Mm-hmm.
RNs only. LVNs, you can, they can't collaborate in this terms of collaboration. Cool? So only RNs. E, what is E? Educate, education. And I like to put with E, evaluation. So, you can't delegate primary education. LVNs can reinforce education, but they cannot be the ones to educate the patient primarily, okay? LPNs can always reinforce, but education, the main responsibility of nurses, especially nowadays, is maintaining high patient education. Because if you educate your patient well enough, it's going to decrease the complications after discharge. So education, if you're going to educate your patient, that's primarily the RN's role. For evaluation, to evaluate care plans, to evaluate the patient's goal for the day, to evaluate trending vital signs, to evaluate if the patient's pain level is getting better. LPNs, CNAs can write down the pain scale, can jot down vital signs, but they cannot evaluate, and that's specifically the registered nurse's role. Critical thinking and evaluation, okay? The last thing, did I mess up? Hold on. Paquettes. Hold on, did I say educate and not evaluate? Okay, well.
Teaching?
Yeah, but I already put that under education.
Oh.
Well, I guess you can do teaching. Yeah, same thing, right? So teaching, same thing as education. I think I screwed myself up there. But evaluation and teaching, same type of deal, right? So basically on your test, on your Nclex, on your multiple choice test, if you see any of these key words, planning, if you see assessments, if you see collaboration, if you see education, right? If you see evaluation, if you see teaching, then that you cannot delegate. You have to assume responsibility for that. If it's reinforcement, if it's a secondary assessment, if it's a no eval at all, if it's reinforcement of teaching, no planning at all, okay? Only reinforcements can LPNs do. So hopefully that helps a little bit with your delegation questions. And don't forget paquette, okay? Thanks, guys.